Okay, so let's take it, I guess let's take it, step by step. We have 4 points that we mainly discussed. Number 1 is the mission of the Palestine Network. 2 is how we're going to help the Palestine Network. 3 is mainly preventive measures, and 4 is therapeutic. And basically the way it went around with the mission of the Palestine Network is basically improving healthcare, and the improvement is going to come from a government standpoint and people standpoint. So we're going to be working on 2 levels here. How we're going to help the Palestine Network. We're going to help on individual base and on a group base. The individual base is what each and every one of us is basically going to be doing to help each in their own sector, you know, as an internist, as a cardiologist, as a surgeon, you know, on an individual base to come here and give back to the community. And on group effort is going to require the help of the Palestine Network itself, because you're going to need some financial support to broaden the base and basically bring more to the community. The third point is the preventive measures, and that's going to come basically from health education, you know, and that health education, I mean, you can think about, you know, printing information, having it on flyers, and distributing it to, you know, just the common people here, you know, like some of us said, you know, about like dietary education, what to eat, what not to eat, what to look for, how to
visit to schools.
I'm sorry?
Visits
to schools, okay. Also, you know, we have to develop some, you know, or help in developing satellite clinics where we can actually screen for common diseases, and if you don't know, you know, that you have a disease, you're not going to treat it, and you know, and usually it gets worse over the time. And thirdly, in preventive medicine, you need to accumulate data, because if you don't have the data, okay, you're basically driving in the dark. You don't know what you're doing, you don't know what's out there, and if you don't know it, you're not going to be able to help. The therapeutic measures that we can do, which is the 4th and last point, is basically in the short run is to coordinate missions to come to different parts of Palestine, and you know, and the missions will be different in different fields. You know, you can have, you know, surgery, different types of surgery, whether, you know, pediatric, cardiac, you know, surgery. You can have invasive cardiology come here and try to do some diagnostic and therapeutic missions here in Palestine. From what I understand, we don't have a lot of oncologists here, or we don't have none. So if we can get a couple of people that would be able to come here and, you know, and share their expertise and do some treatments here. I think our long-term goal as a Palestine Network, because if it's individuals, you know, then it's all good, you know, fine and good to just look, you know, in the next couple of years or so. But our long-term goal should be to build a better healthcare system. And building a healthcare system is going to be from the grounds up. And when I say from the grounds up, that means a medical school. That means, you know, somehow, somewhere, we're going to sit down and figure out the logistics and the steps that we need to take, and how much money it's going to need to, you know, to be gathered to have a medical school. And, you know, because we're not looking at just helping and like keep importing the help from the outside to the inside. The main goal is to be self-sufficient, and the only way of being self-sufficient is to have a good medical school with sound education where they can actually start helping themselves here.